Hello and welcome to today's episode of Jeopardy! My name is Josh Rogers, the host for today. Today we have two beautiful guests with us. Brianna Weir from Boston, a microbiology major from Clemson University, and Amanda Morris from Boston, a genetics major from Clemson University as well. Go Tigers! Today's show will be based on Crohn's disease. Our 5 topics for today: Crohn's disease as a whole, treatment options, innate immunity, B-cell involvement, and T-cell involvement. Brianna, we're going to start with you. Please choose your first category.
Could I please choose Crohn's disease for 100?
What is the most common symptom that patients have when it comes to Crohn's disease?
What is inflammation of the GI tract?
Correct. Next question.
Could I do Crohn's disease for 200, please?
What is the most common form of Crohn's disease?
What is ileocolitis?
Correct again. Next question.
Could I do Crohn's disease for 300, please?
Crohn's disease is most common among people coming from what descent in the world?
European descent?
Correct. Next question.
Could I do treatment options for 100, please?
What is the surgical process in which 2 ends of a healthy bowel are joined together?
Is it hemorrhoid surgery?
Not quite. Correct answer was anastomosis. To you, Amanda.
Could I get Crohn's disease for 400, please?
What are the tears in the lining of the anus which cause pain and bleeding, especially during bowel movements?
Fissures?
Correct. Next question.
Crohn's disease for 500, please.
Blank is caused by inflammation, is an abnormal channel that forms between one part of the intestine and another, or between the intestine and the bladder, vagina, or skin.
Fistula.
Correct. Next question.
Let's go treatment options for 200.
For people diagnosed with Crohn's disease, it is essential to maintain good nutrition because Crohn's disease often reduces your appetite while increasing your body's energy needs. Doctors will commonly recommend decreasing your intake of what carbohydrate?
Would it be fiber?
Correct. Next question.
I'll go innate immunity for 100.
Crohn's disease first comes into play with innate immunity when the bowel luminal content breaks through the mucosal barrier and gets access to what underlying tissue? What does this cause?
Would it be chronic inflammation?
False. The correct answer was acute inflammation. Back to you, Brianna.
Could I go to treatment options for 300, please?
In some circumstances, a healthcare provider may recommend adding an additional therapy that will work together with the initial therapy to increase its effectiveness. What is this type of therapy called?
Is it combination therapy?
Correct. Next question.
Could I do treatment options for 400, please?
What experimental therapy is being researched to help Crohn's patients, specifically with fissures and fistulas?
Is it stem cell therapy?
Stem cell therapy is correct. Next question.
Could I do treatment options for 500, please?
Medication treating Crohn's disease is designed to suppress your immune system's abnormal inflammatory response that is causing your symptoms. What is the form of medication that is most commonly used?
What is corticosteroids?
Correct. Next question.
Could I do B cell involvement for 100, please?
Antibodies are excreted in deregulated amounts in Crohn's disease. Name the top 3 that are overproduced.
Is it IgG, IgE, and IgA?
Not quite. It was IgG, IgM, and IgA, not IgE. Back to you, Amanda.
Can I have innate immunity for 200, please?
TLRs like TLR2 and TLR4 are overexpressed in Crohn's patients, which triggers faulty recognition of pathogens and blank blank.
Chronic inflammation?
That is correct. Next question.
Innate immunity for 300, please.
The bindings of immunoglobulins to blank blocks the innate immune system response by impairing bacterial gene expression.
What is bacteria?
That is correct. Next question.
Innate immunity for 400, please.
Which type of receptor is the first to trigger an immune response following pathogen exposure in Crohn's disease patients?
What are PRRs?
That is correct. Next question.
B cell involvement for 200, please.
Therapy with TNF alpha blockers restore the defect in what type of B cell generation?
IgA memory B cells?
Not quite. Its correct answer is IgM memory B cells. Back to you, Brianna.
Could I do innate immunity for 500, please?
Which gene is expressed in Paneth cells and is considered to be the strongest genetic risk factor for Crohn's disease?
What is NOD2 genes?
That is correct. Next question.
Move to B cell involvement for 300, please.
This picture represents images of what type of tissue in the body after biopsies with granulomas and non-granulomas are performed.
What is colon tissue?
That is correct. Next question.
Could I move to B cell involvement for 400, please?
Patients with Crohn's disease, their B cells appear to be blank and not plasma cells and localized specifically around granulomas.
Is it neutrophils?
False. It is lymphocytes. Back to you, Amanda.
Let's go T cell involvement for 100, please.
The imbalance in blank amounts cause a major role in the development and maintenance of inflammation in Crohn's disease.
What is Th1 and Th2?
That is correct. Next question.
T cell involvement for 200.
Tregs perform a huge anti-inflammatory action. However, studies have showed that mice models were lacking tregs in blank blank of patients with the active disease.
What is peripheral blood?
That is correct. Next question, please.
B cell involvement for 500, please.
Recent research has shown Crohn's patients have decreased prevalence of which phenotype of memory B cells?
What is CD27?
That is correct. Next question.
T cell involvement for 300.
The balance between pro-inflammatory and anti-inflammatory properties is determined by Th1 and Th2 cell ratio. What does this ratio determine in patients?
Is it? I don't know.
Brianna?
Is it the type of Crohn's disease the patient will have?
That is correct. Back to you, Brianna, for the next question.
Could I do T cell involvement for 400?
Dysfunctional interactions between gut microbiota and mucosal immunity leads to the loss of intestinal immune intolerance from an overreaction of blank T cells, and Treg cell production is decreased.
Is it effector?
That is correct. Last and final question for 500, T cell involvement. Do Crohn's patients show increased or decreased cytotoxin T cell activity compared to a normal patient?
What is increased?
That is correct. That concludes today's episode of Jeopardy! Behind Crohn's disease. Thank you guys so much.
Thank you for having us.
Thank you.